Picture the scene. A deadly virus on a cruise ship. People have died. And yet your CDC is staring at it like a dog watching a magic trick. I mean, look, the tennis ball's right behind my back, you dumb dog. And for the record, I love dogs. I just also love that line, so sorry, not sorry. But yeah, while this disease unfolds in front of the world, your president, President Trump, walks up to a microphone and delivers his expert medical assessment. You ready? Here it is.
It's very much, we hope, under control. It was the ship, and I think we're going to make a full report about it tomorrow. We have a lot of people, a lot of great people are studying it. It should be fine. We hope.
Should Americans be concerned that it's going to spread? And how are we
I hope
looking to
not.
get
I
those
mean, I hope
Americans
not. We'll do the
home?
best we can, yeah.
We hope. That's the entire pandemic plan. Hope. He's got nothing else. I mean, he's got MMA Mark Wayne Mullen standing right next to him in front of his pool boy's paint bucket at the reflecting pool, and he's got hope. And so a quick catch up here. You've heard about the Dutch cruise ship called the hantavirus. It left Argentina on April 1st, went across the South Atlantic, seeing penguins, the Georgia Islands, all of it. And by the time it gets to Spain on Sunday, 3 people have died. More than 5 confirmed sick, 4 more suspected. And this virus is a hantavirus called the Andes strain. And most of these hantaviruses, they can't spread from person to person. Andes just happens to be the one that can.
I am currently on board the MV Hondius, and what's happening right now is very real for all of us here. All we want right now is to feel safe, to have clarity, and to get home.
And now, hantaviruses are usually rare in humans, but they're lethal when they do contact humans. The fatality rate, it ranges between 1% and 50% depending on the strain, and experts are thinking that this strain, the Andes strain, is like 30%. There's no cure. The treatment is just gonna keep you alive long enough for your immune system to hopefully figure it out. That's where the hope comes into play. So you would think the United States, which has a CDC, which has decades of pandemic response infrastructure, which has billions of dollars sunk into a system designed exactly for this scenario, would be on top of this. Well, you would think wrong because, well, the CDC got trumped. The CDC has classified this outbreak, the hantavirus outbreak, a level 3. Level 3 is the lowest level of emergency response. And anything below that, it's like an intern just saw it on a Reddit feed somewhere. And why do we only have it at a level 3? It's because the former director of the CDC says it best. The CDC's National Center for Emerging and Zoonotic Infectious Diseases, that is a hell of a title. That person told the New York Times that the CDC isn't immediately notified of anything coming from the World Health Organization anymore. Why don't we get updates from the World Health Organization? Because Donnie, get the light inside the body, Trump pulled us out of the WHO. And it became official just January 22nd of this year. So we do not share health data or information with the rest of the globe anymore. So when a deadly virus pops up on a cruise ship full of Americans, the World Health Organization, they're on a group chat discussing all the best ways to beat it. And yet the United States is over here writing letters with a quill pen. A public health expert from Brown University told the New York Times, we should be able to deal with a hantavirus outbreak much more quickly and effectively than this is happening. Should. If you don't speak Brown University, he's essentially saying, we are cooked. And get this, the Trump administration last year shut down a network of 10 research centers. They were called the Centers for Research in Emerging Infectious Diseases. And Trump's folks said the work they were doing was, quote, unsafe and not a good use of taxpayer funding, end quote. Well, guess which one virus one of those centers was studying as a pilot project? You guessed it, the Andes strain of hantaviruses. Ding, 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 you got it right. The exact virus that's on this cruise ship right now. And the cost of this study was only around $100,000 to fund this pilot studying how this thing jumps from rats to humans. And in government terms, $100,000 is nothing. And yet it was cut, just gone, because the people running our public health agencies right now think that science is woke. And while we're at it, your friend's drunk uncle, the one that got kicked in the head by the family mule one too many times and drinks floor cleaner because the government-sanctioned moonshine's too weak, he's about to run to Facebook and type, "Just give them ivermectin." Stop. Seriously. Now look, I'm not a doctor, but for Christ's sake, listen to some real experts. Ivermectin is a horse dewormer. It doesn't work on the hantavirus, according to all of the real scientists and doctors out there. It didn't work on COVID. It doesn't work on this. Period. Full stop. The fact that we're still having this conversation in 2026 is in and of itself a public health failure. You're out there taking horse paste parasite medicine for a virus. I mean, you might as well rub a potato on your skin. The potato will at least exfoliate. Well, it does nothing to help fight an infectious disease. And now, I want you to imagine, though, just for a second, that this wasn't contained on a cruise ship where they're probably going to have these people quarantined when they hit land. Imagine that this was a real outbreak on U.S. soil, hitting Americans. We saw it just a few years ago. And hypothetically, this thing's spreading. What would the response look like under Trump's cabinet of loyalist buffoons? Let's start with RFK Jr., running Health and Human Services. RFK Jr. is at war with mRNA vaccine technology. It's the exact technology, by the way, that allowed the world to roll out a COVID vaccine in just 11 months instead of 11 years. And RFK Jr. gutted the funding pipeline for mRNA technology. He's terrorized the scientists. He put nutcases on the panels that discuss these things. And so when the next pandemic hits, the most powerful tool in our toolbox has been taken out into the garden and shot, Kristi Noem style, by the health secretary. 2, we're already out of the World Health Organization. And so when this next outbreak starts in Vietnam or Brazil or the UK or wherever, we won't get the early call. We'll get a CNN push notification a week later, the same as everybody else. The exception is that we're the country with 330 million people and an interstate system. So the lag, it's going to matter. The disease will spread before we even know it was here. And number 3, every single agency that was supposed to handle stuff like this has been hollowed out. It's been doged. It's run by loyalists instead of experts. The CDC lost most of their senior staff. The NIH, senior staff gone. The FDA gutted. The Trump-era public health infrastructure is a spirit Halloween costume of public health. It looks like the real thing from across the room, but up close, it's just a guy named Brad with a degree from Hillsdale Online and a podcast. So here we are, 9 or so cases on a Dutch cruise ship. And our president is standing in an empty reflecting pool, inspecting his pool boy's paint job and telling you, we hope. If that's the response to a contained outbreak halfway around the world, what's the response going to be when something like this hits Norman, Oklahoma in July? And because the algorithm is treating this like any other disease, that's why I need you guys to subscribe. That's why I need you guys to hit the notification icon. Because when this thing or something like it breaks, we're going to need to be louder than we've ever been. And the algorithm needs to know that people like you are here. Let me say that again. Subscribe and subscribe now. Because Trump's pandemic plan is hope. And ours can't afford to be.